20-year-old Thomas Lloyd won't be worrying about health insurance for a long time.
Thanks to Obamacare, I'm covered under my parents' insurance until I turn 26.
That provision is just one reason members of the millennial generation aren't signing up for Obamacare in the numbers the administration needs. In what was supposed to be the final days of open enrollment, the administration put on a March Madness full-court press on millennials.
When I heard that people actually watch this show, I was actually pretty surprised.
Hi. Welcome to another edition of Between Two Ferns.
From online comedy shows to sports radio, the president has been working overtime to win over young people.
To get them engaged in the healthcare debate in the process, I think you really have to convince them that this is important for their health well-being, but also their financial well-being as well.
Daniel Cox studies this younger generation. Remember, this group helped put President Obama in the White House. And Cox's research shows millennials support a strong role of government, even government-sponsored health care. But the latest numbers show only about a quarter of those enrolled in Obamacare are between the ages of 18 and 34.
The people least likely to sign up for health care under the ACA are young men who are low income and non-white. And now these folks tend to be Obama's strongest supporters. So when we look for reasons, I think that points less to a political reason and more to an economic reason.
And it's the economics of Obamacare that has the White House courting millennials so aggressively. For Obamacare to work, it needs 40% of the people who sign up to be young and healthy. That's to help offset the cost of the older, sick Americans sure to dominate the health insurance pools.
So the financial outlook is very, very bad for people who are enrolled in the exchanges if they do not get a sufficient number of younger people.
Since emergency rooms are required to treat everyone, Moffitt says young, healthy people have little incentive to join. And in many cases, they can't afford it even if they wanted to.
On 17 different occasions, the president said that the country would experience a reduction in health insurance premiums and that American families typically would see a $2,500 reduction on an annual basis in their premiums. None of this appears to be coming true. We're looking at much higher premiums and much higher deductibles.
Sums that will be even higher if more healthy young people don't sign up. The White House hopes extending the enrollment deadline will make up for lost time.
There's no question, we got off to a really bad start. And that was on us.
But critics say the change in deadline is just the latest in a long line of examples of how the law is in disarray. Jennifer Wishon, CBN News, Washington.